I'm Leonie Watterson. I'm an anaesthetist from New South Wales, based at several public hospitals in Sydney. I got my FANZCA in 1997, so nearly 30 years now as a specialist anaesthetist. So when people ask me what an anaesthetist does, I try and explain that anaesthetists help out when you have procedures where it would be too uncomfortable to have them done awake or without any sort of extra pain relief, I guess. So, and then as part of that, I will talk about anaesthesia and then also about pain. I work in an obstetric hospital, and so we do a lot of obstetric analgesia. When it comes to an anaesthetic, I'll then kind of break it down to general anaesthetic, where, you know, it's like sleep, but it's not natural sleep, it's drug-induced sleep, so people are unconscious. But then there are other opportunities to have things done under nerve blocks, for instance, or with sedation. When I meet patients, I assume that they've already met a lot of people. They won't necessarily know who I am, and that they're probably also anxious. So I go to some effort to make myself sort of prominent to them, and also to be really clear with my communication. So I will make sure I'm looking and, you know, making eye contact. And the very first thing I say is, well, I check that, you know, I've checked that I've got the right name, actually, but then I will say, I am your anaesthetic doctor, and my name is. And I give them my full name. I say, and my name is Leonie Watterson. And then I say, I'm here to look after you today. I generally also introduce myself as part of the team. I'll say, oh, you've already met your anaesthetic nurse, and often there's an anaesthetic registrar, and we are your anaesthetic team, and we're going to take care of you. So that's my opening gambit. Generally then say, how are you feeling? Are you warm? Are you comfortable? All that sort of thing. The other thing I always do, if it's a general anaesthetic, is I always reassure people that I'm going to be there the whole time and I'm going to take care of them. I think anaesthetists really play an important role in being good listeners, connecting with patients, advocating for them. On a more practical side, anaesthetists do need to be multitaskers. They need really good situation awareness, and they need to be vigilant. And I think that does sort of distinguish us from some other specialties. And we have to like science, pharmacology and physiology, and be interested in that and be on top of how everything that we're doing works from a scientific point of view. So they would be my top three things. I work now only in public teaching hospitals and have a lot of exposure to registrars in training. And the thing that excites me most about anaesthetics is actually watching them develop and watching their talent unfold, because I'll often meet them when they're an absolute newbie, and within almost the blink of an eye, they're consultants, and it's really wonderful to see their skills and develop and their maturity evolve. So that's what excites me most as well, because they're the next generation, and I feel reassured. I feel like we're all in safe hands, actually. So for all of my career as a specialist anaesthetist, right from my very first job, involved regular time in a simulation centre, and in fact I worked in the very first simulation centre that was opened in Australia. So that's now 28 years. Simulation has now become quite mainstream in health, but then it was not mainstream at all. It was experimental, and it was something that the aviation industry primarily used. So it's been a really interesting journey, seeing how far we've come with that. But there's sort of I guess the central crux of simulation in anaesthesia is that we use robotic patients. and we connect them to our own realistic equipment and anaesthetic machines and centre them in recreated environments. So it feels very real, and then we're able to recreate situations that happen in real life, although they might happen infrequently. So it's not something that you can guarantee people will learn on the job. So rare events, rapidly changing events, emergencies and the like. And we teach people how to recognise and respond and know how to treat or to respond to those emergencies from a technical point of view, but we also teach people how to work in teams and how to manage themselves, and we call that human factors.